Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good
All
morning
right.
and welcome to Open Your Eyes.
Start your morning right.
I am John Palacio,
And I'm Paul Lopez.
and it's always nice to have you guys in. You actually wake up early this morning and started the morning right with us. We're so glad that you are able to
Yeah.
do that. The weather outside, Paul, is beautiful. Loving
Chilly
every
and
second of it.
nice.
So somewhere around 70 degrees, 72.
Yeah.
That's a great feel.
I stepped outside this morning and felt that chill hit me. I was like, yes,
Oui.
we're in the middle of the week.
Indeed, we're in the middle of the week. It is Hump Day, Wednesday, the 24th day of November 2021. And as per usual, we kick things off with a look at some of the stories that made the news last night, Paul. There were a lot of things that we could actually talk about.
There's a lot.
Including the Narco 4, or Narco 11, 4 of the
11.
Narco 11, who were actually granted bail.
Right.
There is the story of the alleged murderer
Yeah.
who actually went over to Guatemala side. He was captured, brought back to Belize. There is the story, of course, COVID seems to always be here with us. And they're actually saying, okay, this is, when we say COVID deaths, this is why we say that. So there's so many things that we could actually talk about this morning. What's the hot thing?
Well, they're all hot topics, John. I think the first issue we can discuss has to do with the return or the capture of Brian Castillo. We received information leading into news time that he was captured in San Benito, Guatemala.
Wow.
Sometime late yesterday evening. Since then, he has since been returned to Belizean authorities. And so we saw images of that exchange per se being made last night. This is a big one for Belize and Belizeans, as we've been crying for justice. We've been wanting to see Castillo capture, and so the partnership between the local authorities and the Guatemalan authorities definitely took effect yesterday in that regard. Today, obviously, we'll be getting some updates in terms of what happens from here. We know that even though Castillo was captured in Guatemala, that there was no extradition process followed. I'm not sure whether or not they needed to undergo that extradition process before that exchange took place. That's one thing we'll have to look at, or whether or not Castillo was expelled from Guatemala. But we do know that the handing over has already taken place, and reports have emerged of that. Earlier in the day, however, some more happier news was that the son, 7-year-old Darwin Castillo, who was along with his father, I say that he was abducted because he was taken without the consent of the mother
mom.
or any of the other family members. So I say that he was abducted, and I'm sure that there are viewers out there that would agree with this position. Nonetheless, happy to see that he was returned safely
to his
mother in the morning. I reached out to the family to ask if they would be willing to make a comment. They were unwilling, just quoting some concerns, but noting nonetheless that Darwin returned safely and in good health. I just feel for that little boy, because right now the assumption is that he may have been a witness to all that transpired.
Wow.
The night of the incident, Sunday night, in the Santiago Juan
layout
community of San Ignacio, he was with his father. He was there, and we don't know the extent of the damage caused in terms of all that he saw, but we know it
Mental
definitely
damage.
took some psychological effect.
yeah.
And there are those out there saying this young boy will definitely need some sort of counseling.
Okay.
And so that is yet to be seen.
All
What
right.
will
So that's
happen there.
that, of course, is one of the big stories making the news today, making waves over this week, and I'm sure will continue over this week. Also, the road traffic accidents that we've been seeing over this week as well, over the weekend, definitely a lot of families lost a lot of lives. And
We heard from the mom last night,
Mm-hmm.
the mom of the 10-month-old child. Dwayne Moody took to the streets took to her home yesterday and paid her a visit, and they sat down together and had that conversation. It was a difficult conversation, and it brought back all the emotions of that dreadful Monday afternoon, that dreadful Monday evening. We weren't able to get an interview with the mother on the Monday evening, of course, because it was just all playing out. But yesterday, she just spoke of how heartbreaking this is, and I'm certain that words alone cannot fully express what this mother is going through and exactly what she's feeling. But I know that there's no one out there that saw that news piece, that saw that story, and left without feeling some sort of remorse, but also without feeling some sort of responsibility to do better on the highways.
but we hear you with that. And like we mentioned, there are a lot of families who are actually grieving from family members that they've lost out on the highways, byways of our beautiful country, Belize. And then there is the Narco 11 or the 4 who were actually granted bail yesterday.
Yeah, it almost comes as no surprise. Like, to those who keep in touch with the news, we've been saying it, we've been predicting it. These guys will get out from behind bars, on bail at least. It's just how the system works. You have a chance to apply for bail at the Supreme Court level. And what's even more interesting, as their attorney told us yesterday in an interview, is the fact that his reasoning is that they have 9 months for an investigation to take its course, and within that 9 months, these men can be out on bail. Now, it was a hefty bail. Each person was given $40,000 to pay before they could have been released from police custody. So that's a hefty fine. We'll continue to follow that case. I know that investigations are currently ongoing. I don't know how strong the police case is. Dickie Bradley, as he is, made several attempts in an interview yesterday to try and put some holes in the investigation, and so that will be an interesting one to continue to follow up.
And those are just a few of the stories that we're actually following here at 5. Every evening at 6 o'clock, we break these stories down to you, and of course, in the morning time, we shed light on them as well. And we can't wrap this particular segment of the show up without mentioning what the COVID numbers are.
Yeah.
As we're seeing with the numbers of COVID, actually recoveries are actually surpassing that of new cases, which of course is coming along as good news. We also noticed that Belize district, the Belize district, is actually at its lowest at this particular point. What we're seeing on the screen is actually 210 new recoveries yesterday. This is within a 24-hour period, and 179 new cases detected. For me, the numbers under investigations, of course, that number for me is always alarming because there are a lot of people actually going out there to test, and we know how it is within the country. 32 people hospitalized, 15 ICU at the ICU or administered at the ICU, and we lost 2 lives yesterday. And the 2 lives we lost yesterday were actually folks who were not vaccinated. So these numbers continue to show in terms of why you should go on out to get vaccinated. And that's one of the things we do here, Paul, is that we advise the folks to go and get vaccinated. There are vaccination clinics popping up every part of this country as the Ministry of Health and Wellness makes sure of that.
And we continue to see the numbers in terms of positive cases go down. I like to look at the silver lining in the clouds. We continue to see the number of positive cases go down. I think it was only about a month ago that we were somewhere over 2,000 cases, active cases, and now we see where we're somewhere within the range of 1,200 active cases, I believe. So down by at least 1,000 active cases. It's still not a sign that we could live in a free-for-all Belize per se, because when those numbers begin to jump 100, just 100 active cases, just 20, just 2, it's cause for concern. So
Indeed.
to be over 1,000 still,
those numbers are definitely alarming. But
Right.
Paul, I'll tell you what, we also have good news coming out of these stories in terms of COVID, for the fact that we did got an interview with Dr. Eck, well loved by the Belizean community. And so here's a look at that.
okay.
After a week of being at home, the symptoms started to get worse. And I had made a pact with my wife that if things got worse, I wouldn't, as all doctors do, hold it in, but I would divulge to her, things are getting bad. So in the dead of the night, I started to get severely short of breath. And so I called and arranged for the team to get me at KHNH. I was transferred there, spent a couple days, and then transferred from there to BHPL. The last I remember of it is getting off at KHNH. I don't remember anything until waking up after all the intubations and after all the surgery. The problem with this is that during that time that you're not moving, the muscles in your body atrophy. So presently, I'm sitting in a chair, a wheelchair, but I can't stand and I can't walk. But I do have movement in the lower limbs, and my physiotherapist, Ms. Trejo, comes in every day to check on me and to give me my exercises. She's my torturer every day, but it slowly will come to pass, I hope.
All right, and there we have it. I'll tell you what, it brings joy to my heart to see that's my buddy. That's a great friend of mine there, and a great friend of everybody in this country. It's such a nice, it's so nice, Paul, to see him sitting up and of course talking to the public. That's, oh my goodness, that's joy to my heart.
I mean, it's a true testament of what you can do with good medicine.
Indeed.
And good care when you contract COVID-19, because we all know that Dr. Eck was in a critical state.
Yeah.
But he was cared for, and it's good to see him back up and well.
Indeed. Of course, still fighting to be 100% as we continue to share prayers with him as he continues to recover.
Indeed.
But it is that time of the morning whereby we move on and we share with you. We hope that you've been motivated, actually. If not, then we've got some additional motivation here with you with the Eye Opener. As per usual, the Eye Opener is taken from dailyom.com, and it goes like this. Much of the tension we feel during the holidays is a direct result of our own expectations. For many people, the advent of Atom heralds the start of a stressful holiday season. From November to January, we feel pressured to be wonderful hosts, entertain scores of loved ones, and remain calm amid chaos. Yet much of the tension we feel during the holidays is a direct result of our own expectations. In our efforts to please others and to craft the ultimate celebration, we overextend ourselves and miss out on the spirit of the season. This year, consider transforming your approach to your celebrations. Instead of striving for perfection, endeavor to enjoy the treats that only come once a year, the company of family and friends, and the little expected occurrence that make each holiday unique. Before being your whirlwind of seasonal preparations, ask yourself what aspects of each holiday are most important to you and what holiday-related goals you hope to achieve this year. A year from now, you'll have only a handful of vivid memories to look back on. If you take a realistic and heartfelt view of the holidays, you'll be sure to remember them fondly.
That's a good one.
I know, right?
It's
I know.
right in time for the season. I think it's just appropriate considering the fact that we're coming to the end of November.
Yeah,
And we're
yeah.
jumping headfirst into that Christmas season. There's so many things you want to do, so many things you want to accomplish. Well, I put up the Christmas tree.
Oh, paint.
You paint. You make sure that you probably get the new sofas or new fridge, new
Yeah.
stove, new curtains,
New Mali.
new mat. There's so many things you want to do, but what's the priority?
Yeah,
I think
yeah.
that's one of the takeaways for me. What's the priority?
Yeah.
What is it that you'll remember next year, a year from now? What is it that you'll say, man, I'm glad I invested in that
Yes,
specifically?
yes, yes. It is the reason for the season. It's
Yeah.
what I always say. It's not necessarily the Malay and the this and the that everybody
Yeah.
would want to buy. It's the fact that you're celebrating with family.
Yeah.
Most of us, that's our go-to, to be around everybody and just loving each other. And for those who have passed and gone, I always say the best gift to man is the gift of memory. That you're able to think about that person, that you're able to fathom some of the conversations that you have and dwell right within that and put a smile on your face for the fact that at least you're celebrating their life. All right? So that's how I sum it up. That's a great, great eye-opener, and I really and truly appreciate that one. Speaking of appreciation, we hope that you'll appreciate what the weather is going to be like. We'll be joining the forecaster shortly at the Met Service to tell you exactly what to expect with the weather, and I think she's on the line already. Can I get a thumbs up there? There we go. Love her. So here we go. We've got Francisca on the line. Good morning.
Good morning, John.
How are you,
Good
Francisca?
I'm doing great, and how about you?
We are doing excelente, but we could do even better when you tell us what the weather is going to be like. So let's jump on into the general situation. What should we expect?
Okay, we'll see cloudy spells today, and for this morning, we will see light showers, but mostly over the northern coastal areas, and a little bit over us as well. And then that will be it for the day.
All right.
So,
And,
Yes.
well, of course, I think you gave us a 24-hour forecast there. So let's jump on into the winds. Where should we be feeling these winds from?
okay, winds will be out of the north and northeast, 5 to 15 knots, and that will produce choppy seas.
Nice. So we're going to have some great temperatures, though, if we're going to have those 5 to 15 knots winds.
Okay, so we're on the cool side, 82 along the coast, 84 inland, 72 up in the Maya Mountains. That's for this afternoon. And tonight we are seeing 72 along the coast, 68 inland, and 62 up in the Maya Mountains.
Beautiful. Sounds great. So what about our
Right.
extended forecast? What should we expect?
Okay, so that will be for Thursday and Thursday night. We'll be seeing only isolated showers around the country. In Creole, leave it a rain.
Leave it a rain.
Francisca, we're so thankful. But what about the tropics? Is there anything we should be looking out for?
It's quiet at this time. We are nearing the end of the hurricane season, but still, let us not relax a little because, as we know, and I'm saying over and over, hurricanes can form on the tail end of cold fronts, and we are seeing them coming down frequently now.
Wow.
So, okay.
We've been warned. Thank you, Francisca.
You're welcome.
All right. Do have a great day.
Thanks, and same to you.
All right. So there we go. Now you know exactly what to expect with the weather. Francisca is saying that the highs are 82, 84, and 72, and in the evening time or nighttime, 72, 68, and 62. You know that spell, right? The Kool-Aid guy will bust out the wall and say, "Oh yeah, cool." That's exactly what he'd say. But moving on in the show for this morning, what to expect on a Wednesday morning? Well, the first segment, Paul, what should we expect there?
Well, in the first conversation, we will be having a very important discussion, John, with reps of the KHMHA. And they'll be discussing the way forward with us. So we will be having in studio with us the CEO at KHMH, Chandra Cancino, and chairman at KHMH, Dr. Andre Sosa. Huge conversation.
All right, so we're looking forward to that. In the second conversation, it hit the social media by storm.
Yeah.
Belizean artists signing with Universal Music, and we'll be having a few of them in with us this morning to tell us exactly what that contract is about and how it could actually better their lives. We're looking forward to it. It's a great one for our country.
And in our final conversation, we'll be having representatives from the Belize Tax Service, and they'll be providing us with an update since the launch of their Iris Belize program. So we'll learn more about that.
All right, so we need to take the break. Just before we do those, Shans, I never sent him a picture, but we've got a birthday shout out. I'd like to say a happy birthday to, there she is. A happy birthday to my brother, Elmer Reyes. We love you so very much. Elmer is always the life of the party. Cool, calm dude, man. I'll tell you what. Elmer Reyes, from the entire family, especially from Mom Catalina Reyes, wishing you all the very best to you. We give on the last two words, yes, Paul? There we go. We're going to take the break. When we come back, we'll dive directly into our conversation. Stay with us.
We have been a partner with Smart for over 10 plus years. We have a full Smart plan we use as our major driver for our business. We have a service that rolls over in that if you call one and it is busy, it rolls over to the next line. So once you call us, you can get us at any time. Before we got this Smart service, we were paying upwards of nearly $2,000 in phone bills. Since we've had our Smart service, we pay an average about $600. So we've had tremendous saving, more than 50%. For the businesses, if you want to save money, switch to Smart because it is far more cost effective and the service is excellent.
Smart continues to be innovative in bringing new technology and meaningful savings during these challenging times to businesses across Belize. Sign up for our VoIP technology or broadband packages and save more.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
How can we support the emotional well-being of older adults during COVID-19? During the COVID-19 pandemic, and particularly while in quarantine, individuals, including older adults, may become more anxious, angry, stressed, agitated, or withdrawn, especially those who need healthcare assistance or have cognitive decline or dementia. Here are 4 strategies that can help you in supporting an older adult during this difficult time. 1. Communicate information and listen. Present with accurate, simple, and accessible information and facts about the COVID-19 outbreak, its progression, treatment, and effective strategies to prevent infection. Listen patiently to their needs and concerns. For older people with mild cognitive impairment or early stages of dementia, inform them of what is happening within their capacity and provide support to ease their anxiety and stress. 2. Promote positive mental and emotional health. Provide access to available mental health and psychosocial support services, also known as MHPSS services, for older adults and communicate when and how they can access them. Help older people keep regular routines and schedules as much as possible. You can also help them create new ones, including regular exercising, cleaning, daily chores, singing, painting, or other activities. Facilitate regular communication between older adults and their friends and families. 3. Help with medical needs. Make sure that older adults have at least up to 1 month of all the regular medicines that they may require. Explain how to use protective devices in a clear, concise way. Always be respectful and patient. 4. Assist with daily activities. Provide older people with details related to how and where they can get practical help if needed, like calling a taxi, dropping off supplies, having groceries delivered, and requesting medical care, as well as information on any locally available social support programs and services. For more information, consult the webpage of the Pan American Health Organization, www.paho.org/coronavirus.
Accidents on the job can result in a loss of life, which is devastating. If your loved one dies as a result of a work-related accident, you may be able to receive a death benefit from the Social Security Board. Death benefit is paid to a widow or widower, children under 18 years, or up to 21 years if attending school, or dependent parents. Death benefit is a monthly payment paid to the dependents of the deceased. Dependents receive the death benefit for life from the date of their loved one's death or until they no longer meet eligibility. Want to know more about death benefit? Visit our website or contact any of our offices to have someone assist you. Also, be sure to visit our Facebook page and give us a like to stay informed. Social Security Board, safeguarding you, your family, your future.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
And we're back, just like that, we are back, and we're moving now into our first segment for the morning. And this is a conversation about the, to actually discuss the way forward after receiving their $1.5 million from GOB. We're talking the KHMHE, all right? So in to talk to us about it, Chandra Nisbet-Cancino, who was the CEO of the KHMH, and of course, Dr. Andres Sosa, who is the chairman of the KHMHE. I hope I got that correct. Got a lot of E's, But good morning and welcome. It's nice to have you guys in.
Good morning.
Thank you.
Thanks for having us.
Thanks for having us.
We this conversation started not too long back. There are a few things that we would definitely want to discuss this morning with respect to where the KHMHE is, and of course the KHMH as we speak. I would like to start with, of course, how we got in the situation of even talking about or having to receive this money. Why did this money come up? What's the situation there? That's where I'd like to start, and then we move on what we're going to do afterwards.
Yes, good morning, everyone.
Good morning.
Basically, we are into the second year of unusual occurrences, namely the COVID-19 pandemic.
Mm-hmm.
And the response to that has been ramped up in terms of medications, supplies, and man hours and woman hours devoted to trying to keep our patients healthy, trying to keep them alive.
Mm-hmm.
The KHMH has traditionally received a subvention of close to $30 million per year. But naturally, with the demands of COVID,
mm-hmm.
the huge demands in terms of working hours, in terms of supplies and medications, has meant that those $30 million traditionally set aside really don't cut it. And because of that,
mm-hmm.
and given the economic crisis that the world and Belize are facing, we have seen a shortfall month to month in terms of the amount of money that we receive.
In the subvention?
Well, not from the subvention per se, but we've calculated that to be able to deal with COVID, we would have needed an additional $400,000 approximately per month.
Wow. $400,000.
$400,000 per month to be able to cope adequately with the COVID requirements. And that wasn't forthcoming, and that has brought us to the point where close to $5 million has been accrued by the KHMH in terms of output or expenditures that can be directly attributed to COVID.
That's $400,000 monthly. That's an additional estimated $10 million a year, thereabout. If I do the calculations correctly, the government, on the government side, what was the agreement that was made in terms of funding, financing COVID-related experience?
Well,
Expenses, sorry.
The government is the government is the government.
Yeah.
And even though the KHMH is a statutory board, we are a part of the government.
Yeah.
We are here to provide for the people of Belize. Having said that, at the start of the COVID pandemic, there was a meeting that involved several parties, including the Ministry of Health, the Labor Department, the Carl Huchner Workers Union, which was an ad hoc committee at that time. And the purpose was to try and prevent exactly this scenario, where there would be a demand that might not be met in terms of the provision of supplies and in terms of the monies needed to fight COVID. And I think that came from a historic situation where Carl Huchner would oftentimes be faced with inadequate flow of supplies, but also it was in the context of a labor dispute with regards to the increment and to the raise of pay that was due. But additionally to that, of course, the prospect that with the looming financial crisis brought on by COVID, that intense measures would need to be taken, including possibly pay cuts. And the responsible persons at that time foresaw that possibility and tried to get ahead of things by making sure that efficiencies were set in place to try and minimize wastage and also to ensure that the flow of funds, the commitment from central government would be there so that they wouldn't fall short on what they needed to do.
But having had, and we want to bring Ms. Chandra into the conversation a bit in a few, but having had that foresight that the demands would increase, and as a result, a need for more resources would also increase. And I understand some of the measures that were put in place, but what sort of agreement was reached that to meet those needs in terms of resources?
Well, essentially, it was agreed that central government would assume full responsibility for bearing the cost of COVID-19.
Wow.
And also that the subvention would not be touched, provided, of course, that Carl Huchner would be able to be efficient in what it did then and what it would do going into the future. I think that certainly to a large part, the foresight should have meant a smooth delivery of the process. Nevertheless, we know that COVID has created lots of novel and new situations. So you have to give a little bit of leeway in terms of unexpected developments. Certainly, the advent of the Delta variant with the large numbers of patients that it brought, the large number of deaths that it caused, that was one of those unexpected situations. And so the system needs to be a little bit more flexible, a little bit more responsive in terms of these kinds of events. And I'll tell you, there are countries that are in their 4th, 5th waves and so on. Don't think that we are so special that we will necessarily be able to avoid further waves. No?
So what sort of financial injection per se was made to KHMH from the government's part side in the first year?
Well, I won't be able to give you any figures directly. I would say that we've always been in a situation of catch-up. And that is why we are at the, well, it's 5 million less 1.5 million now. So we've always been in a situation of catch-up for different reasons. But principal amongst those, of course, is the provision on time of the medications and supplies that we need.
So we're at 1.5 million. This check just received last week by the KHMH. You did mention a while ago that this is actually just a piece of the pie that is actually owing to. What's the remainder, and was there a sit down with GOB in respect to what are the timeline to receive your full funds?
Well, we haven't been able to get a commitment in terms of the timeline. We are cognizant of the fact that there's an economic crisis ongoing, and what they had available for us in the first instance was the $1.5 million, which we are very thankful to the Honorable John Briseno, the Prime Minister, to the Financial Secretary, and especially to Ms. Maria Cooper, a member of the board, who fought very hard for us to get this first disbursement. We have asked that commitments on a timeline be set for the disbursement of the remainder, and we are working on that.
Chandra, to bring you into the conversation a bit, do you get the sense that it is the dutiful responsibility of the government of Belize to ensure that the finances and the resources are there in terms of dealing with COVID-19 patients?
Well, good morning once again, and thanks for having us. Pretty much like what the chairman says, these are unprecedented times, and so it was difficult to plan for the current situation. In a lot of cases, well, for instance, the first wave wasn't a quarter as bad as this current wave, and perhaps we felt like many countries, oh, you know, this isn't too bad, you know, and that may have affected the, you know, getting ready for something like this. Yes. But yes, I do believe that our situation, our position as a tertiary and only referral hospital in the country is a integral part of the Ministry of Health and by extension the government of Belize, and that is an important partnership that we both have a responsibility to deliver the best possible services to the people of Belize, and I think you know, that is where we're trying to continue that partnership and ensure that we get what we need. Primarily, people say it's for the hospital. It's not necessarily for the hospital. It's for the people that go to the hospital, because those are the persons they're in the center of everything that we do.
Yeah. It is a service being provided to the people, so it's not for the hospital. It is for the people. Which brings me, because you did mention partnership, which brings me to the board. We did see in the news whereby the Minister of Health and Wellness went as far as to say that the board is not doing enough, which of course prompted well and reputable Dr. Cuellar to eventually resign from the board. very vocal, that much we know. What's the position of the board at this particular point as we speak?
In what sense?
With respect to what's the feel like? What's the sense like with the board, and where do you go from here?
Well, the board needs to continue doing its work. We need to be able to provide to the CEO and her team the resources that they need to do the job. We are committed to that. Naturally, there will always be differences of opinion as to how to proceed. In the end, though, we are part of a team, Team Belize, if you want to call it that. And it's very important to put aside personal feelings. There's a job to be done. People are dying. So we will continue to do what we need to do. We will continue to lobby the Ministry of Finance, the Ministry of Health and Wellness, to ensure that our team at the KHMH has what it needs to do the job. I have had an opportunity to talk to doctors on the front line, doctors downstairs, who are very frustrated, and nurses as well, and general staff who are very frustrated because they want to do their job well. They are sick and tired of people dying, and they want to have on hand everything that is possible and necessary to do their jobs. They are the persons that we are working for. The patients are the ones who we are working for. So there is no place for personal feelings in this.
Let me ask, apart from the subventions received from the government of Belize, and of course this outstanding debt, perhaps you may answer my question, but apart from that, how does the KHMH make its finances, its income?
Well, that's a very good question, Paul, because yes, indeed, you know, the number, I think it's 30 million that they say we get, that Carl Hitchner does receive, thankfully, as a subvention. That's divided into 12, and monthly we get $2.4 million.
So it's not like an injection of 30
no, it's
million
a monthly,
right away.
No, it's a monthly subvention, and of that $2.4 million, about $2 million is paid to salaries.
Wow.
So the institution is then left with $400,000 to run the entire organization if we were not doing our part to generate revenues, which we are doing. You know, we have services that we provide. We have radiology services, outpatient services, lab services. However, due to the pandemic, again, we had to shut down a lot of those services. And so we were strapped with generating income. And so that put us further in a situation of debt, because essentially our providers, who I must take a minute and express my gratitude to a lot of them who have continued to provide us, give us credit and provide services, even though we were unable, or we are unable to pay as we should be. And so, yes, we do generate our own revenues. We are trying slowly to get back to that. We have opened the specialist clinics a little bit. It's in a building or next to the hospital. You know, to try to keep people safe. But yes, we do have our services that we provide, that we generate our income. But unfortunately, with COVID, a lot of that had to be immediately stopped, you know, and a lot of it needs improvement as well.
And I asked that because I wanted, I guess, to play the devil's advocate a bit and piggyback on something the minister said, that obviously was a part of what rubbed Dr. Quire the wrong way, which is basically, in essence, you guys need to do more. There's more that you guys can do to bring in finances for the hospital. Do you take that responsibility?
Certainly, but anybody who runs a household knows that you can't run a household without money. So, amongst the services that we provide, for example, we have the elective surgeries. Somebody comes in for a gallbladder surgery, somebody comes in for hernia repair. Those things require medications. You have to put the patient to sleep to be able to do a surgery like that. But if you have a shortage of anesthetic medications, can you do that? If you have shortages of other supplies, can you really do that safely? And of course, as well, with the limited space and personnel that we have available, it becomes very difficult. So we need to have everything on hand to be able to deliver those services safely. As CEO said, we have reopened outpatient clinics. We continue to do physiotherapy, but at present, our elective surgeries are really not where they should be. We have gotten a little bit of respite, having received some of the anesthetic medications, but there's still a huge list of things that we don't have. And we're not casting blame in any direction, but our responsibility is to represent the real picture as it is. We're not here to cover anyone. We're here to provide a real picture so that, you know, knowing what the real thing is, you can make arrangements to solve those problems.
Speaking of the real picture, let me just get one other question in on that. You spoke of the shortage of medication. We're hearing it, we've been hearing it on the news, but at this point, how severe is that shortage?
It continues to be severe. Perhaps CEO can give us some details as to the challenges we continue to face.
Well, yes, it's the access, the supply of a lot of the medications is very low, or in some cases there does not exist. They don't have any to supply us with. But what we have been doing is outsourcing or sourcing, finding other sources, and Karl Hirschner itself is purchasing the medications. So we're not at a place where Karl Hirschner might not have. We're at a place where the Central Medical Supplies, which is the department, the procurement center for the ministry, does not have to supply us with. And there are cases where some medications are not even available in the country because these procurement services sometimes take place outside of Belize, depending on the medication. So it's a daily challenge. You know, thankfully we have a pharmacist and a medical team that are always monitoring these resources. I mean, to the last vial. I must also express my gratitude to the private sector. Belize Medical Associates, Belize Healthcare Partners. We sometimes go and borrow medications from them, and then we repay when we get it back.
Is it a matter of a financial shortage, or are there other factors at play that are causing the shortage? What are you hearing from the procurement unit where these medications are concerned?
I wouldn't be able to speak too much on the reason. I understand shipping is a challenge right now. I'm not really sure what the delays are, because from the point at Karl Hirschner, all we are seeing is that, you know, we're not getting it and we need it, and so we are trying to find our own sources to ensure that we have the medications that we need for our patients. And in some cases, it's medications that, if it's antibiotics that you need to be discharged with, the patient can go and purchase that at a pharmacy. Yeah. So our concern is for the medications that we need for things like anesthesia, intravenous medication that we would need for persons that are, you know, fighting infections, etc. So we have prioritized our needs as well.
Life-saving medication.
Life-saving medication.
And of course, there's so many other things going on at the KHMH. So we definitely would want to touch the COVID situation. But just before we get there, going back to Dr. Cuellar's situation there of resigning from the board, one of the things that he actually accuses of is, is the board not necessarily having a voice. The board just acting on what is being told to them, maybe by the Ministry of Health and Wellness. Are you able to address this, Chairman?
I think that if I remember correctly, what Dr. Cuellar said is that some members of the board. So it's important to be specific about that. Okay. Because in the last year or so, we have been very vocal, exposing the issues and problems that plague us. Essentially, there is perhaps a difference of approach. I think that I'm much more diplomatic than Dr. Cuellar. I think that's an understatement. And it would be irresponsible and dishonest of me if I were to say that a lot of what he said isn't true. So, but everybody has their way of addressing the issue. We keep ventilating and we keep talking. In every organization, there will be differences of opinion. And that is why you have a board that is diverse. It's very important that it mirrors what happens in the society at large. It should be pluralistic and it should be democratic. Having a board is not running a dictatorship. Okay?
Have you gotten a chance to sit down with Dr. Cuellar and speak with him following his resignation from the board?
We've chatted. I asked him to reconsider his position, his resignation. He does not want to return, but I also think that he can't be forced, naturally. But I think that he sets the tone that I would like to see, in the sense that we want people who are independent-minded, whose primary focus is serving Belize, not narrow interests. I've spoken about this in the past as well, and I hold fast to that. We're here to do a job for the people of Belize, all the people of Belize.
Yeah, indeed. And of course, there are definitely two other things I'd like to touch on before we get into what the COVID situation is. The story of faulty equipment being donated to the KHMH, and also the number of pregnant women who were hospitalized and died from COVID there are saying that the health care for them were less, which of course caused their demise. Can you speak to this?
The issue of supplies of equipment is something that keeps causing great consternation. We want to be able to rely on these supplies without having the constant fear that something is going to go wrong. So we keep working on that. As soon as a problem is identified, our engineers, our people in charge of maintenance look at it. Oftentimes they would pass on the equipment to the NEMC, to the National Engineering Unit, so that analyses can be done of what is wrong or what may be wrong with these equipment. We also work in an old hospital with old electricity installations, and we want to be sure to understand what necessarily is happening. That's a process. It is important, I think, to analyze everything from top to bottom to be able to come out with the right answers. In that regard as well, we want to be certain that the people who provide us with those things are of the most ethical standards. We try to get assistance and guidance from PAHO, for example, to ensure that the things that we get in are up to the standard. Yeah. We have a long way to go, a long way to go in terms of those kinds of guidelines and practices, and it's evolving, obviously. But yes, it is of grave concern to us.
I would imagine, listening to what you're saying, is that the needs of the hospital goes beyond that $400,000 needed monthly for COVID-19 situations and COVID-19 patients. What I'm hearing you say is that there were needs way before the onset of COVID-19, infrastructural needs, for example, perhaps some electricity issues there. How, Dr. Sousa, how did the hospital get to this point? How did we allow for the nation's largest public healthcare institution to get to the place where it is today, where there's so much needs and so little resources to meet those needs?
Paul, if I were to describe my true feelings with regards to how we've gotten here, you probably would have to put bleeps in that conversation. It's been 25, 30 years of the same BS, whereby we don't get the resources, where it's been business as usual. We just continue to float along. The attitude that, oh, it's good enough because we're in Belize, has been what has happened for the last 25, 30 years. That is why we're here. We have a backward mentality when it comes to dealing with health and so many other problems in this country. That is why a group of medical professionals got together 2 years ago and decided to work on a health policy to change the way we approach health in Belize, from the bottom to the top. This health policy was presented to the BMDA, the Belize Medical and Dental Association, in October of 2020. And it was received with wide acclaim because it was seen as a way of leaving behind the corruption and the backwardness that has plagued this country from ever since. We had the good fortune of having the Honorable John Briceño there for that meeting, and he was able to see that almost to a person, the medical community supports change, supports a change in the way things are done in this country. And there are two things that I think we can identify: weakness in the system and corruption. Those are the things that hurt this country. And we in the medical community want to see a change to that. It is only when the system is strengthened, it is only when you root out corruption that you will be able to transform the KHMH.
Which brings me to the CEO. Madam CEO, you know, you've just been instated at the KHMH not too long ago. What would you like to, what you're saying, Dr. Sousa, those words are very heavy because they're your personal and true feelings in terms of what you would like to see for the KHMH. Which brings me again to the CEO. What would you like to see, and how do you expect for us to get there?
Well, one of the reasons I applied for the position at the KHMH was because at the time my vision was very much aligned with Dr. Sousa and the boards. So I would certainly like to see a transformation at KHMH. Remember, KHMH is a lot, people think, oh, hospital, you know, doctors, nurses, and patients. But it's so much, as Paul said, more than that. It's, you know, it's a lot of moving parts all at the same time. You have the dietary services, you have the operation services, you have human resources. It's a lot of things. And what I think has been happening over the past is that we fix a little bit here, we fix a little bit here, we fix a little bit here, and we're not having a holistic approach on transforming the KHMH into moving into that other state, or the 21st century, as we're soon going to the 22nd. Yes. And so I think that is what I would like to see. We have a team, a fairly new team of senior directors, or new team of directors at the KHMH. And so hopefully we can start the process of recovery, of rebuilding, and But what is important is our partnership with the Ministry of Health and Wellness and with the government, by extension, the government of Belize, because we are an integral part of that team.
Yeah.
And without their support and their understanding, it's going to be a challenge. So I'm looking forward to strengthening the relationship with the ministry and with the government, and trying to ensure that they understand, because I think a lot of it too is they don't have the insight of really what happens every day at these hospitals, what challenges we're going through, to be able to share that with the public as well. And I think that's one of the things we had committed to when I first came on board, was to be open with the public and have that discourse so that it's their hospital. This is where they come. Yeah. This is where, chances are if you and I get in an accident, that's exactly where we're going to go.
Yeah.
And so the support from the public as well is important, or discourse with the public. It's really, that is how I see us going forward. Yeah. We're looking to trying to develop a strategic plan as well, for a period of maybe 3 to 4 to 5 years. It depends on what we decide, so that we can set some goals and start moving in a direction where we can see the transformation from the beginning to the end, and again, not starting and being unable to complete it.
Yeah, we know that time is dwindling by, but I really don't want for us to end this show by not asking what the COVID situation is. We're seeing numbers going down, especially in the Belize district. What's the situation right now with the KHMH with respect to COVID?
Sorry, go ahead, Doc.
We are at about half the occupancy for the COVID unit as compared to a month and a half ago. So definitely the numbers are going down, but we are worried because there have been a number of events in the last week or so that could mean, or that could see numbers rising again. Greater exposure means greater levels. So we're keeping our fingers crossed that this tendency, this downward tendency continues. But there are no guarantees, no?
You guys support the move to extend the curfew? Well, to shorten it, per se? I would imagine that's what you're speaking about when it comes to more exposure?
Remember we've had national holidays in the last few days. The last week. Greater movement means greater exposure. Yeah. Then of course some of the schools are open, so greater movement, greater exposure. We have to wait and see.
Where in terms of the $1.5 million, I can't pass up asking, where does that go? Where will that be invested?
Okay, so first of all, it's not money that we have to invest. We are very much in debt. And so primarily, our first priority is to pay off some of those debts.
Indebted to
who? Indebted to a lot of our suppliers.
To everybody.
Yes, and I'm sure they're watching and waiting. And so yes, we had a meeting with the finance department yesterday, and we looked at our 120-day debt or 90-day debt. We have a lot of those. That alone is about $1 million. And then we have suppliers who we owe over $1 million to one supplier. Wow. And so it's not, yes, we are very grateful for it, and we're going to try to, we have suppliers who don't give us any supplies because we owe them.
Which is business.
Right. Yeah. I'm not faulting them at all. Yeah. And so we're looking to see the best way that we can make some payments and see if we can, invest a little bit into improving some of the like you would say, some of the machinery. We have areas that we need to purchase, for example, in the X-ray department, cassette and call it. So we're trying to prioritize. We haven't decided finally yet what we're going to do with it. But it's really money that has been spent.
So that's gone already.
That's gone. Yes. Wow.
Yeah. I mean, this conversation enlightens me per se on what I would term a crisis situation at the KHMH. People are dying. One, there's infrastructural needs. There's an infrastructural crisis, as I understand it. There's an equipment need for equipment. There's a shortage of medication as well, and I'm sure things could be added to this list of things. How do you go into work on a day-to-day basis with this type of weight on your shoulder, understanding that you're leading the nation's leading public health facility?
We've been doing it in my case, for 25 years. And it's something that has to be done.
Yeah.
It has to be done. There are, as I said before, no space for personal feelings, for self-pity.
Yeah.
We just have to do it. The people deserve nothing less. And even whilst we do it, we plan for the future. We plan for beyond COVID. We will transform the KHMH and that compound into a healthcare city, where you don't have to worry about trying to find $30,000 to have a knee replacement, or to have a heart surgery, or to have chemotherapy or radiotherapy. We are confident that we can do it, and we will do it, because this is what we've trained for.
Yeah.
We know what we're doing.
Yeah.
We need the tools, we need the money to do it, but we will do it, because people like Ms. Consino, the nurses and doctors who go in there every day and do the hard work, know what to do. There are patients who are suffering for different things, not just COVID. They deserve nothing less. And we will be vocal about asking what we need, because we can't close our eyes to the suffering of the people of Belize.
In closing, just allow me to ask Chandra a question. Now you're new there in terms of this term of service. We've talked a lot about the crisis situations there. However, in your coming to the hospital, what sort of acquaintances have you made with the staff there, and what is your view when it comes to the staff? Apart from the crisis, the true heroes, as we understand it, are those working at the hospital and going there daily, despite the financial challenges and all other challenges that they have to face.
Well, again, that's another reason I took on the challenge, is because I know the team of persons, for the most part, that work at the KHMH. And like you said, they are all heroes in their own way, from the kitchen to the morgue, to the wards, the administration, everybody there. And I must say, while the staff morale is still a little bit low, they are very aware of the situation that we're in. I can see, persons trying to save in different ways, trying to do their part to ensure that the hospital is able to function as best as it possibly can. And for that, I am truly, truly grateful. So if it wasn't for a vision and a team, I probably would not have taken the challenge. And I think that right now, the Carl Huchner has both. And so I'm still taking time, I'm still learning a lot. And I am just hopeful and optimistic that in 2022, we will certainly start to turn things around.
All right. Well, we've got to leave it there for today. It was very, very good to have you both in. CEO at the KHMH, Chandra Nisbet Consino, and Dr. Andres Sosa, Chairman of the KHMHA. Thank you guys for joining us this morning and wishing you best of luck.
Thanks for having us.
Thanks for having us.
We're about to take a break. When we come back, we'll be visited with Belizean artists. They'll be sharing with us the thrill of being signed to Universal Music Group. Now that's big. They'll tell us more about that when we come back. Stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
Feels like forever you've been burning for me. I'm here now. Oh, it's a fire indeed. 'Cause I'm oh baby, skin soft, leg thick like this. Wet lips drip, drip like this. If you come a little closer, you will see that baby I'm bad.
Bundle the fastest, most reliable, unlimited broadband in Belize with your prepaid or postpaid mobile plan or Netflix. You can bundle your broadband with your prepaid and enjoy 50% off all national calls, plus get SMS and data. Paid plans? Then bundle with any speed and pay only $25 extra monthly to enjoy unlimited smart-to-smart calls, plus 500 minutes, plus 6,300 megabytes of data. Stream unlimited HD movies and TV shows with our broadband, plus the Netflix add-on for only $30 monthly, and enjoy streaming on your laptop, TV, phone, or tablet. Visit a smart showroom near you to sign up or upgrade to the bundle that's right for you. Smart, bringing people together.
Hi, I'm Chef Sean Quillen. I love cooked fish fillet, and I prefer to get my fish straight at the fish market right here at Conchel Bay. But you see, sometimes you come out here and you don't know what you're getting. The fish has no label, it has no patch of skin. But don't worry about it. I am here today to teach you how to avoid fish fraud. When purchasing your fillet, remember to look out for the patch of skin required by law. Or you could tell them by the physical characteristics. Long and slender, barracuda. Nice white meat, hagfish. The deep bloodline from the bow to the stand, that is jack. When buying in bulk or buying out of a bag, make sure to inspect each fillet individually to avoid what we call in a Creole, pussy in a bag. What a pussy in a bag? Fraud. If that's not the help you, because even for me as a professional chef at this man for 40 years, that's really challenging. All I could tell you is buy from a reputable source or buy it whole. And if all of that's not available to you, just go to fishrighteatright.com and we at Oceana have a fish identification chart. Because guess where you're going here now? We talk about bloodline just now one thing, and that's a snapper, right? Classic snapper. What kind of snapper this?
This is the shark.
Nurse shark. highly illegal. No make they trick you, no make you buy pussy in a bag. Do the right thing, fish right, eat right.
At Fuse Bistro Limited, we care about the well-being of your family and the environment. Our Your Caribbean style restaurant features a wide variety of tropical lunches, gourmet dinners, fused granola, organic coffee, infused sangrias, margaritas, and martinis, and much more for you to enjoy. Find our organic food products at Belize On, Bistro, Grab on the Go, and stores in San Ignacio and Santa Elena. WhatsApp us at 624-0500 for deliveries. Fused Bistro Limited, pure and natural.
And welcome back. We are back and we're moving now into our second segment for the morning. This one is all about Belizean artists being signed to one of the biggest record labels in the world. We're talking here Universal Music Group. Whoa, this is big. Now in to tell us all about how the signing was or what it means and what it's going to mean for them is none other than Super G Martinez. He's in with us, T.Y. Linares along with Stig the Artist. My brothers, good morning and welcome.
Morning, guys.
Yeah, there you go. You know, Super during the break, Paul made mention of something, and
we have to bust this myth, John.
Yeah, we have to do it. Well, Super, we were told that you don't take your shades off because when people look in at your eyes, they turn hudut. That true? Let's get on into it, guys. Let's get on into it. And I see Stig on the screen. Let's start with Stig. Stig the Artist, my brother. Once again, good morning. We had you on like I think last week, but thereafter,
I feel like I work. I feel like I work at Channel 5 at this point.
But you had your stint. But guys, you know, so last week, you know, social media blew up by storm when they heard about this signing. So much so a few people were saying, "No man, this can't true. This is not true. This is big." Stig the Artist, tell us, what is this signing about? How did you find out that, you know, you were going to be one of the artists signed? What does it mean, my brother?
It means a lot, man. I am grateful that I am one of the artists in this situation that I can go and represent Belize because I know what I'm capable of. I know my goals. I know my way of thinking. I know, you know, the way I am as a person and what I can be and what I want to be. So this means a lot. And a while back, Shine had mentioned it to us. I want to see it come to life before I even make any kind of announcement. And now that it has happened, you know, all praises to Shine. All praises to God, but, you know, gotta give the man of roses. So respect to Shine, man. Not only for myself, but for the rest of the artists and for the country. I'm pretty sure everybody feel the same way I feel. Very grateful.
Indeed. Let's jump to T.Y. T.Y., talk to us. How do you feel about this?
Everybody. Well, you know, this is our new era of music, you know, and we say a lot of artists came along with, a lot of great artists came, you know, Paul Labora, and the Palacio program of different artists with Lila Verda, you know, and the people that actually paved this way today, you know, open the doors for the artists there, you know, to lead up to the Super G again, our general, and I'm really proud of this among artists there with Super G, you know, different artists, you know, and general respect see away always, because like, you know, watch your man for your small part TV with the punta, with the agreega, with the punta, where they go down. This door open like this, you know, especially to Shine our multi-platinum recording artists, and people can't take that away from the man. Yeah. No care what they do, no care how much dirt they try to show. And my brother name, you know, I proud to say we're black man, all of we as black man in this country, they try to be independent, and that's what UMG Records do to us. They allow we to be independent artists, and I start me with the work at UMG to an international level now, whereby our songs going international, everything is distributed the right way, where it's supposed to be. for international stage, you know, and I'm very excited for it, especially someone like me where my song already been international in the Caribbean, you know, so I look forward for the thing, and I'm excited now for ready for work, I'm ready for grind, I'm ready for work, I got a lot of material, album ready, stock up, so I'm ready.
Yeah.
Super G, you're one of the more senior artists here. All respects, all respects and kudos to you. I mean, I personally respect your craft as a young man. I could see how you've contributed many laughs and many good times to myself, to my family, to my friends. I mean, so there's many cases where a party isn't a party without a 1 and 2 Super G songs, right?
3 and 4.
3 and 4. And once you start, that's it.
That's
You
it.
can't leave that. Super, speak to us about how you became involved in this signing.
Yeah, well, way back, I've never taken my eyes off the prize.
Yeah.
I've never stopped believing that even reaching at this age, you know, I always knew that it's just a matter of time for something like this happen.
Yeah.
You know, I trust in a God, and I always pray that, you know, when the time comes that I'm prepared.
Yeah.
And I've been recording music for like, I've been in the business for like almost 30 years.
Wow.
Recording as a solo artist from 2001, preparing myself for this, you know, and I feel so good that as a senior artist, I had one of the senior artists along with their young cats. You know, we have a lot of talent. You know, we have the energy, and today amongst them to be a part of this crew here, we get signed. And again, big up to Shine, thanks, Shine Barrow and Universal, because without him, this never be possible. You know, kudos to the man. And I feel so good for them among their young artists to represent the leagues.
All right, so let's get on, and I'll keep you there, Super G. Let's get on into the nitty-gritty of this this signing. What does it constitute? What's the nitty-gritty of it? What's the grind of this contract?
Yeah, for me, it's a distribution deal. I always say from way back, when the time comes for a sign with a label, I don't want to sign no 360 contract. I don't want to give up my whole rights, my life to any record label. So when Shine came up with this, that, okay, the label, they basically want to do a distribution deal, I say, okay, this is right up my lane, because I've rejected labels before who want to sign me up because somehow they deal with and they come with, they never were right deal for me, you know. So when this came about, with this distribution deal, I jumped on it quick. With this, I own 100% of my master. I own most of my publishing. So it couldn't be a better deal than this.
So you make the music.
I know a lot of people on Facebook talking, yo, the label I own, the label I own everything. No, we own our master.
So you make your own music. You invest in making your own music, your video and whatnot, and then what? You distribute it to them, and they distribute it out.
They distribute it. So we do the recording, carry the master to them, give them the master, and they take it over from there.
Wow.
But we own the master, just the duplication of the music and selling it online. That's what they're in charge of. But the master is ours. Most of the publishing is ours.
Let me ask Stig TY, how is this different, this distribution deal? Because I've heard the criticism, and I have to ask, how is this different from distributing your music on
different
streaming platforms?
Yes, Spotify, iTunes, and whatnot.
Apple Music.
Yeah.
I'm sure it cost you somewhere around $50 Belize per se to upload your music to these streaming sites that has millions of followers across the globe. What's the difference?
Well, I feel like the differences are like you have YouTube now, but our big YouTube are free. You not pay $1 to upload a song for YouTube.
Yeah.
YouTube are like the new world now. Everything you go, everything there for YouTube, understand me? So like when they do the distribution on the different platforms, all the artists supposed to believe SoundCloud again are free. SoundCloud are free. Most of these platforms are free. So all the platforms give you whereby label like a Super G, so a label like that now are really you could sign to a label, but they will own you. You will be a slave for a record label basically. So this is an opportunity. It give you like a place to be independent. We are continuing to do we are be for one boss. Everything was legit for we, but at the same time, we distribute to our international level on the world market. You know, different parts of United States, in the Caribbean, how it's supposed to be. You are getting a percentage, the label are getting for their percentage, and this is a big move. You know, the people not a chance with the people. They say a lot of people they try misconcept the whole thing. Oh, read a thing, good man, accept chance. This is a distribution deal. You do it one thing, we are continue with one thing. With that, they will get a percentage, we will get our percentage. And we come out for what we make, you need to put in the work. We come out for what you make, that's the way you do. So you work hard, play hard, you work slow, you get paid low.
Stig, your thoughts on this, brother?
Listen, I believe that all these artists who are signed are artists who have been working, like Shine said, who have been working, who have material out. You know, Super G, name speak for itself. He have hundreds of songs.
Music, yeah.
EY got a lot of videos and songs and a lot of hits. Deja and Marlon Vanton and myself. You can't say we know the work. However, we don't have the reach. Belize have what? The most abroad and in Belize, I'd say 800,000 or maybe 1 million people.
Maybe 1 million, yeah.
The most, you know what I mean? What then they do, they basically give we a bigger reach, than the reach where we can't reach. They basically will pay for stuff we can't pay for. Put we in platforms we necessarily can't do, because a lot of the stuff, for example, a lot of songs that they get more forward with, we do spend some, as much as the views are authentic, we do spend money on promotion, and that's not a lot. But in our eyes, a lot, because we don't have that kind of money there. Now, what they would do that stuff that we can't really do. And radio stations, we don't even have links to. Spotify playlists, we don't even know about, you know?
Yeah, it's I mean, UMG is a huge deal in terms of the music industry. And you're right, I could see how this boosts your reach in the sense that if you seek to distribute your music on a streaming platform, it's you doing it by yourself versus having this world-renowned organization carry your music to audiences.
Let me give you an example. Let me give you an example. You guys know about the page on Instagram and YouTube, Hip Hop Belize?
Yes.
You guys ever heard about it? All right. How many young artists now got a Hip Hop Belize and say, yo guys, can you drop this? Can you drop this song for me? Why? Because they feel like they don't have enough following and enough reach. And if they can do that, imagine us still not global artists, still necessarily only big in a certain region, getting this deal from a far bigger company. So definitely, man.
It helps. It helps your status. It helps your status. I mean, it's like you have a trip to Placencia and you either arrive on a Shaw bus, no offense to Shaw bus, or on a private jet, right? Instantly people want to question who they on that private jet.
Yeah.
Who lands?
So this is a private jet status.
This is a private jet status.
It's true.
Right. So what?
Listen, guys.
Go ahead. Yeah, go ahead.
No, I say, listen. Dave Chappelle said, right? Social media is not a real place. I really and truly don't really pay mind to any criticism, any bad criticism. I really and truly don't. I don't even use social media as much as people think, because that's not a real place. I'm all about love and positivity. So big ups to everybody. We're happy for we, and we want to see we win.
Yeah. There are artists out there though that in a sense may benefit from the fact that eyes will be on Belize. Would you speak to that in terms of encouraging other artists that are on the ground working in Belize right now? A TY, Super G.
Yeah, Super G should be the guy for that.
Yeah, I mean, with this platform, this global reach we have now, the door is already open. Now they just walk in and maintain that discipline or carried to a notch higher, because we are representing Belize now on a global stage. So, and I think like what Stig said, the artists then will get signed up, artists will have the acts together, artists we've been pushing, and artists we've been pushing in a positive way and represent Belize well.
Yeah.
So we just need to keep that going and keep on representing this beautiful country well and bring out the hits, because the door is already open now. That just we for walk through it.
I think one of the things that people would have thought as well, especially being signed to a label, that you're actually given gigs elsewhere. You're given international gigs. These people are actually going to work for you to make sure that, one, your music is being pushed, and two, that you're actually being seen on the international stage performing live. Is there any such thing within this contract?
Yes, we have shows. I mean, Shine have shows already planned for next year. You mentioned it, but we're not getting into details yet about their live shows outside of Belize. But also the beauty about this also is that, for example, I've been trying to do a collab with some major artists for years. I able to get a collab with Marshall. I wrote music for bands in Honduras, but on a more bigger level, through this label, we already have the connection for collab with major artists. I know I mentioned the names, but already some big artists where we are able to collab with, because they are signed to Universal Records. So this really will benefit us, not just us having music out there, but able to collab, and meet different artists who are already made it to the top, to talk with and get that guidance from them.
Now, TY, in order to distribute, in order for UMG to have something to distribute, there must be something created. This agreement requires that you have products, that you have songs, that you have records for them to distribute. TY, if you would speak to the extra grind and motivation that you must now have.
Well, like for me, not change. I've been the grind, like all the artists where they on this platform, where they are right now, like Questiga, Super G, so we've been the grind, not change, and that's what extra grind, like the artists there where they right now, that the artists there, but speaking about myself, not change, you are said what I said, the raw dance all for me, but positive in a positive kind of way. So my image not change, my song not change, not change. I want to show the world Belize. I want to show the world south side of Belize, where I come from, not change me. I want to show the world south side, Gill Street, George Street. So my thing was stay how I stay, at the same time to a positive and upliftment music for the ghetto youth, especially from the place where I come from. You understand me? I go a long way, man, and from the grime and from the mud, but I've been dead. A lot of people dead around me. A lot of my cousins are dead. A lot of friends I know died. And like, if you're in a position like this right now, you just have to work harder. I can't look back. I have my kids there now. I have my family, and that's positive movement. Positive movement. Continue to work, keep a positive mind. I believe in a God, and push out the best material I could push out for Belize. I represent my country and my community.
Easy. We definitely had you on a few times, TY, and you did mention about your collaboration with people like Popcorn and them. Are those things still going on? And after this signing, have they reached out to you to, give you a kudos and say they want to work with you?
Yo, of course, you have an unruly, not change, me and Popcorn are good friends, I have a lot of records over that side, I have a few stuff over there, with Unruly Camp CAA, and they reach out to me, they're really proud of me, with the work pass, thing I want to talk about right now, because we got things in the pipeline, but see where to I continue to do me, I'm a person that dependent on people. I continue to make my grind, my song in the end of the day. Nobody can do it for you, nobody can help you get big. Only you could do it for yourself. Like what Shane Victor said, you have to continue to grind. I can't wait for nobody else say this feature, that feature. I want to show the world my song. I able to stand up for my own, I defend my own, I have my nation behind my back. About my country.
Sig, you have a catalog of music, as do TY and Super G. Does this distribution deal include, Stig, some of the tracks that you already have, or is it that you'll now have
make
to create
something new.
new tracks, new records.
No, it's a new deal. You know, today is a new day, so it's new music. I'll be working on an album. So a lot of people always think when you drop this album, right, this is the time. And lot of new music. Maybe I do pull some old stuff, but stuff in the sense of unreleased stuff that you guys haven't heard.
Yeah.
And the producers, do you get to select which producer you're working with?
I'm at first one team always, man. You know, DJ Perf, big up yourself. I recently started working with Randy Sutherland, and same way we're gonna try our best to include a lot of younger producers because Belize's full of talent. So, but same camp, you know, manager keeps the same, Riches the same. DJ Perf is still on the team, you know. I still have Dando around me and World Four and all them guys.
So what's the span of this contract? Is it a lifelong thing, a few years? What's the lifespan of it?
For me, I got albums I need to get done, which I'm excited about.
How much?
What's the lifespan of the contract? Is it for 1 year, 2 years, 3 years? How long is the contract for?
Well, I have a couple albums. Let me just say I have a couple albums. It's not lifetime. I just have a couple albums I need to
produce. All right,
to get done.
And then you go from there. Super. Final words are yours, my brother. It like Stig mentioned, it is a new day, and things are actually rolling, and it seems to it's only going to get better for you guys. What are your thoughts? Final words are yours.
Yeah, I'm going to mention also, I mean, my style, what I've been asked to do is to keep that Super G crossover style. Like, for example, Party, Kick Off, Wadanele, you know, and I wouldn't want to be a part of anything where I can't bring my Belizeanness to it. So I'm glad that, you know, they say exactly where it is set up. So that they were there. You know, I will never stop being Super G. And also, every year before November, I have to come up with my Punta Hardcore Punta November track. You know.
All right. Super, thank you.
Can I pick up somebody?
Yeah, go ahead.
Can I pick up somebody?
Go ahead, definitely. Final words.
Do this right, and that's why big up my supervisor, Mr. Apollono. Big up myself, I come for the shift, right? And the past man, I said, yo, boss, I'm going to do an interview now. So I big up Mr. Apollono Customs Department. The whole of Customs Department was supporting me. And also I big up my supervisor, Mr. Apollono, my whole family, my whole team, man. And big up Channel 5, say away.
Big up yourself, TY.
Easy TY, Stig the Artist, Super G. Thank you guys for joining us this morning to break down what the signing was like and how it's going to be. Thank you. All right.
Such a great conversation.
I know, right?
Yeah.
So we're about to take a break. When we come back, we'll be having in the Belize Stock Service as they'll be providing us an update to the launch of their Iris Belize. What is it? What's going on with it? We'll tell you exactly what's going on there when we come back.
Hello, friends. This is Dr. Bob Roberts with another 60-second sermon from God's Word. The Bible says, "For my thoughts are not your thoughts, neither are your ways my ways, saith the Lord. For as the heavens are higher than the earth, so are my ways higher than your ways, and my thoughts than your thoughts." Many years ago, two old, tired Kentucky pioneers met one cold, bleak February morning. One of them asked, "What's new out here, neighbor?" The other replied, "Nothing, nothing at all, except for a new baby boy down to Tom Lincoln's. Nothing ever happens out here." Little did those two poor, despondent pioneers realize the history that was being made with one of America's greatest presidents being born. In some of our darkest moments of despair and discouragement, have we not also felt that old pioneer's feelings? Nothing ever happens out here. No one probably felt this more than Abraham Lincoln himself in the years to follow. It appeared that he was a man marked for failure. He suffered from melancholia, endured long periods of depression, could barely see out of one eye, had frequent nervous attacks, experienced severe headaches, indigestion, and nausea, And on the day he delivered the famous Gettysburg Address, he was coming down with smallpox. In 1831, he failed in business. In 1832, he was defeated in the legislature. In 1836, he had a nervous breakdown. In 1856, he was defeated for the vice presidency. In 1858, he was defeated for the Senate. But in 1860, he was elected president. If you're going through a dark time in your life and you cannot make rhyme or reason out of it, remember that God's ways are higher than your ways and that our sanity rests in His sovereignty. Today's 60-second sermon has been presented by Christian Foundations of Faith in cooperation with the Baptist churches in your area.
It's a fact that your credit lasts longer when using Smart. During these times, we're all trying to find ways to cut costs and save the little resources we have. With Smart, it's easy to do that. It's a fact that with Smart, your credit lasts longer. You can call Smart to Smart and Smart to Digi using your promo credit, while with the other guy, you can only call OnNet, Digi, or BTL numbers. What does this mean? You get to call any national number using your promo credit. Your promo credit is free, so that call is also free. Know your facts. Don't be tricked by the other guy. Be smart and save your dollars.
The TV you love is always with you. From live TV, sports, and on-demand titles. Choose your plan today. Plans start as low as $15 per month. My TV. Entertainment anytime, anywhere.
I was officially tasked by my work to attend the first barbershop training, and I found out that it's a really refreshing thought. It helps a lot. It gives you a fresh look at life. It gives people a chance to develop. It gives people a chance to grow. It gives people a chance to be themselves, and it helps them to grow as a person. For me, what I took the most from this session was the fact that sometimes we try to give rules and regulation to our kids growing up, like boys shouldn't cry. Certain things are just for girls, certain jobs are just for boys, and we kind of hold back young persons from reaching to their full potential.
It's key for me to understand that gender-based biases are real. It's something that I will take and convert into my knowledge and make sure that I push out when it comes to offering these services here at the Department of Youth Services.
I'll be committing to working with my kids, working with my friends, working with the young persons that I come in contact with to put an end to domestic violence, gender-based violence, and violence against young people on a whole.
Imagine going through your entire day without the burden and risk of carrying cash on you. Belize's shift to digital wallets has begun with eCash. We can now skip the cash when collecting money or paying for our essentials, all while using a fast, easy, and secure platform. Simply add funds to your wallet via bank transfer or at an agent, and you're good to go. You will be able to make quick, easy payments simply by scanning QR codes. And best of all, it all happens just like that. Payments are as easy as clicking a link online or scanning a QR code. Download the eCash app from the Google Play and Apple App Store today and take your first step into a cashless lifestyle. The future is here with eCash. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257 to find out more.
are back, and we're moving now into our third and final segment for the morning. And this one is all about a conversation with the Belize Tax Service. They'll be providing us with an update of the launch of Iris Belize. Now, what is that? We've got the folks in to tell us all about it. We've got with us Lisa Mayen Claire, who is the Deputy Director General of the Belize Tax Service, and also Michelle Brown, who is the Manager of Taxpayer Service, Belize Tax Service. Ladies, good morning and welcome.
Good morning, Belize, and good morning.
You know what? I guess you guys practiced that synchronization yesterday. I heard it. I heard it. But let's jump on into it, and let's talk about the Iris Belize. Belize Tax Service, Iris Belize. What is Iris Belize?
Well, Iris Belize is our new online portal where taxpayers can now fulfill all tax obligations. So they can, right now, currently, they can file a return, any return tax type, and they can also make their payments online.
So when was this program launched? I understand you had a launch before, right?
Yes, so we had a launch, actually a hybrid launch the end of September, but the system became available the 4th of October.
Okay.
So starting the 4th of October, taxpayers can now register for an online account, and we are able to link their online account to their tax account so that when they log on, they can see all their tax information, what they have filed and what they're paying.
Why the need to move into this direction?
Well, for one thing, we know that as a modern tax administration, we need to always continue to make strides to make it easier for taxpayers to fulfill their tax obligations. So whilst that responsibility is on taxpayers for them to pay taxes, the compliance cost should not be high so that it makes it difficult for a taxpayer to comply. And so all of this is moving not only for us to provide better services to our taxpayers, but for us to administer the taxes easily, and we're able to provide better services to you.
This is definitely something that I think was very important for the country to be a part of. So it begs me to ask the question, how receptive is the public or the taxpayers to this platform?
Well, the taxpayers have been very receptive when it comes to the online push. And you know, we tend to have long lines during our tax days.
Yeah.
And now the online portal eliminates all of this. So taxpayers look forward to not have to worry about the long queues of line on a tax day. And we have had 92% of our LTP taxpayers, which is the large taxpayers, that have been registered.
Wow.
And initially, October 4th, when it was rolled out, it was mandatory for them. And they have all jumped on that bandwagon, and we are very grateful for that, because now we have seen a less taxpayers during the tax day in our queues, and the taxpayers have also called in and trying to inquire about how to get their online account active.
So it's basically giving that ease of access to taxpayers. Is this also a part of your push, your move, your efforts to get those outstanding taxes?
That is exactly right, because whilst you have quite a number of compliant persons in Belize that actually file and pay, we know there are those who don't. We know that there are those who should be paying that are not paying. And so paying taxes persons should only pay their fair share. We're not expecting that persons pay anything more than their fair share, but we need to also get the other persons within the tax net. And so that is what the system will help us to do, because we now will be linked with third parties to get information on persons who should be registered, so that it is easier for those persons who are paying.
All right. Let's get to how is the system used? Where do I go and what do I do to get registered?
Well, the process first starts for businesses. They have to send in an authorization letter informing us who their main user will be. That's the first process. So they will send a formal letter on their letterhead stating, John is my main user. They will indicate your social security number, give us a copy of your social security. In that interim, you go ahead and register or create your online account. It's simple biodata that is asked, and you confirm your information via your email. Give us a quick call, tell us that you have done this process, your account has been completed. You will now like to be linked to the tax account.
Mm-hmm.
We then ensure that on our end, the linking with the tax account that you're authorized to view has been done, and let you know log in, log out, and you have complete access to that tax account.
How much?
And
Go ahead.
We want to encourage that it's not only for businesses, it's also for employees, because we are all taxpayers as well.
Mm-hmm.
So it's for everyone that is in our tax base, which is businesses, which include companies, partnerships, sole proprietors, and also the employees.
Do you anticipate an uptick in tax revenue collection as a result of this program?
Exactly. This has been a significant investment that has been made in purchasing this new system. And for other countries that have purchased a similar system,
Mm-hmm.
they were able to see increase in revenue. So that is exactly what we envision should happen, because like I mentioned earlier, we should be able to get other persons who are taxable, who should be paying taxes within our tax base, for them to also pay their fair share of the taxes.
There are a lot of people who would say, you know what, I get extra money and I get taxed very heavy for it. But at the same time, I still feel that one of the most important things for success is the buy-in process by the public. Why should they feel good for the fact that they're actually paying their taxes or doing their fair share of tax payment?
John, it should make you feel good when you pay your taxes. You're contributing to the economy. I think sometimes persons don't sit and realize what they are doing. When you pay your taxes, you're contributing towards the development of the country in which you live. So if we want to always see things get better, it has to be financed. It has to be financed from somewhere, and it's financed from our tax dollars. So when you pay your fair share, you are helping to build the country that you live in.
How so speak to the behind the back in the background, the works in terms of the teams that are set up to ensure that this program flows smoothly.
Well, internally we have, I am in charge of the taxpayer service, so I have a fleet of staff who is here willing and able to assist. While we speak of the online account, we do have assistance in-house, whereby if taxpayers don't have access to internet or mobile devices, they can come in and our staff show them how to create their account, how to access their account. And we also still have the in-house line that they can make their payment. So we do have many assistants. We have several hotlines that they can call for assistance. If they have any queries, we try to assist them the best we can. Mm-hmm. We need them to remember that this system is for them to find ease, let it be effortless for them, that they don't have to worry about anything like the additional payments they have to pay to the couriers to bring in their returns.
Yeah.
They have to have that additional cost to do their returns through accountants. This is ensuring that they can do it on their own as well.
So when it comes to filling out your TD4s and all that, this portal actually gives you that leeway of getting it done the easiest possible way.
Correct.
Yes, John, we also, like Ms. Michelle mentioned, we have video tutorials on the BTS, the Belize Tax Service website, that actually takes you step by step on how to register for the account, how to link your account. It also shows you how to actually file each different type of return. So there's guidance along the way so that when you log on to the portal, you know exactly what to do. And failing that, Ms. Brung and her staff are there to, hold your hands along the way.
What are some of the main challenges that have arisen since the launch of the program, if any at all?
Well, sorry.
Well, currently, one of our challenges in the TPS unit is whereby taxpayers forget how to ensure that they confirm their account, something that I mentioned earlier. When they do create these online accounts, they need to ensure to follow through to the end process and confirm their account. If they don't confirm it within an hour, now the problem lies whereby they cannot access their online account and they cannot utilize that same email address again to create that account. So we want to encourage them to ensure that they follow through with the process when creating their account so that they don't end up in this problem at the end.
If I need some more information, I live in Punta Gorda, I live in Corozal, or some remote area. Where can I go to get information about this portal?
Well, we have branches in every district, John, as well as on the Belize Tax Service website, it has the information for all the numbers. So like Ms. Michelle mentioned, in addition to our landlines, we actually set up additional cell phone lines so that taxpayers, especially in relation to questions on this portal, we ask taxpayers if they can utilize the cell phone lines, because the cell phone lines are manned by persons who will tell you exactly what you need to know about the portal.
In terms of security, we're talking data, personal information. What's there in terms of security? We're talking about money as well, and I know that may be one concern.
Okay, so our portal is hosted by CITO, the Central Information Technology Office. And so they assist us with the security feature. They are ISO certified, and so they help to ensure that taxpayer information that we have in our system is secure. And one thing I want to mention is that Ms. Michelle mentioned the process of the validation, because I can recall someone mentioned yesterday, why do I need to go through this? Why do I need to still contact your office? I've registered for an online account. Why do I need to contact your office? You need to contact the office because we have to ensure that you, the person who actually created that online account, you should be that individual that should have access to that tax account. So there's a validation and verification that happens at our office to ensure that when you are linked to that tax account, you are actually the owner or the person who is authorized to use that account.
Beautiful. So 2022 is fastly approaching. What is expected with the IRIS, and how do we move forward with it?
Well, one of the things that we want to encourage, like Ms. Michelle Brown had mentioned, it was mandated for large taxpayers. And out of that 260 that was targeted, we had 240 that have already registered. Wow. We know that next year, March, employees will now be required to file their returns. And so we are encouraging the employees now to sign up for their online account and for us to link your online account to your tax account so that March, when you're due to file a return, you can do this from the comfort of your home. You don't need to come to our offices to file your return.
Wow. All right. So it's easy access now. Do I need to pay to register?
No, you don't. It's free. Everything is cost free, and you just have to find the time to go on and create this account. But I need to add to what Ms. Lisa mentioned a few minutes ago, that come January, it's our new phase that will be launched, and that will be our inquiry phase where taxpayers will be able to send in their inquiries via this portal rather than coming into the office or having to call the landlines.
Wow.
So that's an additional feature that will be launched or brought out in January. So we have several things that we're looking forward to and which taxpayers also should be looking forward to, because we know one of our biggest issues right now is the refund for employees.
Yeah.
So with this new online portal, it also allows the employers, when they file monthly, they have to submit each and every employee information on a monthly basis. So at the end of the year, when in the past, we used to have this backlog of reconciliation of employers' account.
Mm-hmm.
With this new system, it's allowing us to do that reconciliation monthly. So at the end of the year, there should be a smooth process to complete and issue refunds where necessary to employees.
Wow. All right. And like for folks who may be owing in terms of taxes, are they able to use this portal to make payments?
They're able to log on and they will be able to see what they owe. And there will be the feature, like Michelle mentioned, they can send inquiries, sign up to make arrangements on how they can pay their arrears. So those will, that feature will be available in January, where you can send those concerns. And like Miss Michelle mentioned, it becomes cheaper for you. You don't have to use, I know everybody has a cell phone and it's expensive to make calls. So now you can actually send those queries via the portal.
Wow. All right. So Iris is definitely here to stay, and it makes dealing with your taxes much more easier, right?
Yes, it does.
All right. Well, Lisa Mayen Claire, Deputy Director General, thank you so very much, along with Michelle Brown, Manager. Thank you guys so very much for joining us this morning and explaining to us what Iris is and how it works. Thank you.
Thank you guys for having us.
Thank you.
All right. We're about to take our final break of the morning. When we come back, myself, Paul, we'll be wrapping things up. Stay with us. We'll be back.
Like other vaccines, the COVID-19 vaccines being developed have been through the same trial phases and rigorous process required for all vaccines. Global efforts on the development of the vaccines are built on existing research from previous coronaviruses like MERS and SARS-1. As COVID-19 vaccines are approved for their broad use in the population, be reassured that they will continue to be monitored to identify any adverse events. Your safety is our top priority. Vaccines bring us closer.
Hey son, how was your first day at sixth form?
Really cool. It was great to see my friends, and I really love my teachers.
I'm so happy to hear that. I'm sorry I wasn't there for your first day, but I'll be back from Corozal next week.
It's okay, Dad. I can't wait to see you. Oh, and please remember, I still have some books I need to purchase.
Ah, yes. Let me e-cash you that right now. Money has been sent. I add a little extra cash just for you.
Whoa, Dad. Thanks. Got it.
You're welcome, sir.
Download the eCash app today and take your first step into a cashless lifestyle. For more information, visit www.e-cash.com or contact us via WhatsApp at 613-0257. eCash, the future is here.
When something is good and you can save, that makes it even better. Like this guy, he buys Flex bundles using his promo credit. No worries when his primary credit is finished. He gets talk, text, and data for free. Or her, she calls her family internationally with her promo credit. And with data packages so affordable, she even does video calls. Smart continues to offer great deals and affordable promotions. As a small business owner, she saves when she uses her promo credit to call the other guys. All Smart customers enjoy more triple days and knowing they can use their promo credit, which just lasts longer. Smart, bringing people together.
And we're back. Just like that, we are back, and we have come to the end of our program for today. We had a great time sitting down with you and providing to you the conversations that we feel is very, very important. The first one, of course, a conversation, a good sit down with the KHMHA in terms of where they are now, where they plan to go, receiving that much needed $1.5 million, which is just a snippet of what is actually owing to them and how they plan to carry that out.
It's really a drop in the bucket. If you got the chance to listen to that conversation, you hear the crisis situation over there, and it's multifaceted, the situation, and so we continue to keep our eyes on the situation at KHMH. There's hope under new leadership. There's plans, strategies in place, and so we look forward to see how things progress over there.
All right. Our second segment, of course, was a great sit down with 3 of Belize's artists who were signed under the Universal Music Group in terms of how they plan to move forward, how they felt about it, and what the contract constitutes. So that was a great sit down with Super G, TY, and Stig, the artist.
I must mention that I received word that under this signing, Stig's first project that he'll be working on, he starts working next week in Jamaica.
Wow.
And so that's big news coming out of Stig's camp, and we look forward to seeing more of what happens there.
Indeed. And Iris Belize, now you're able to actually go online using that platform, that portal, to check your taxes, file for your taxes, and get yourself registered as a taxpayer, and continue to move our country forward with respect to taxes.
Definitely.
All right, we've got to go. We would like to say thank you to all the guests for this morning. And this is not possible without you. You wake up every morning, open your eyes, and start your morning right. Now, with that said, if you've got any questions, any concerns at all, you could drop us a line. It's right there on the screen. There it is. There it is right here. OYE@channel5belize.com. You could also check us out on Facebook at Open Your Eyes BZ and on Instagram at OYEBelize. Do me a favor. Make sure tomorrow morning when you wake up, you could
start your morning right.
As per usual, you keep your eyes, your minds, and
your heart open.
That's my boy. We're going to see you soon. Make sure that you enjoy your day, and we'll see you again tomorrow, Belize. All right? Do enjoy.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.